During the pandemic, telehealth became an essential tool for medical access, but now the federal government is considering some changes. Channel 8's Veronica Barreto joins us now to tell us why. Veronica?
Because of the challenges the pandemic brought for patients and their doctors, the government relaxed some of the requirements for drug prescriptions. But now there is a federal rule proposed to control the access to powerful drugs.
The new federal rule would require patients to see a doctor before getting prescriptions for some drugs like Vicodin, Adderall, and Ritalin.
Individuals who are seeing their physician through telehealth for the more addictive medications will have to see their physician at least face-to-face one time a year for that initial diagnosis and prescription.
This comes after a study found there was a risk for opioid use disorder related to telemedicine. A Bryan Health professional says there are pros and cons that comes with the rule.
It can be a positive thing for individuals who might be abusing the system and are like, well, let's make an appointment and let's get these medications through the telehealth system. Because what they found is that there are individuals who have been abusing the system across the United States.
Dr. Myers says it can also have negative impacts. Expanding telehealth has helped many get needed treatment, especially those in rural areas.
Because telehealth is so convenient, and it's made it so that individuals can have those appointments and have those connections with providers. Now this is kind of putting a barrier in place for some of those families, and it's going to make it difficult for some of those single parents and for some of those rural families.
But aside from the new rule, Dr. Myers says telehealth is a very needed tool, especially for mental and behavioral health.
We want folks to be able to connect to those local resources and that we can help them get connected to what they need and what's available.
Officials say plans are to have the new rule in place before the COVID-19 public health emergency expires on May 11th. People should start planning now with their providers if they need to visit in person.
All right, some important information, Veronica. Thank you so much. Let's get to Chief Meteorologist